Here is a follow-up MRI demonstrating the outcome of a contiguous ACL from femoral to tibial footprint of the ACL. This ACL is fairly uniform in its signal intensity and has a trajectory parallel to Blumenstadt's line compatible with a normal thickness taut ACL heel, whilst on the other side of the screen we've got the non-healing outcome, whereby you can see that the ACL is attached to its tibial footprint. You can see the inferior 1/3 of the ACL and then a large gap from here to the femoral footprint of the ACL compatible with a non-healing ACL. So here are two follow-up MRIs on two different patients. The patient on the left shows the outcome of a normal thickness ACL heel, whilst the patient on the right shows the outcome of a reduced thickness ACL heel. So when I start on the patient on the left, you can see as I scroll through these images that the ACL remains of uniform thickness along its entire length from the tibial through to the femoral footprint of the ACL. Whilst on the images on the right, as I scroll from the tibial through to the femoral footprint, you'll notice this is the native thickness of the ACL here, closer to the tibial sided fibers. But as you scroll posteriorly, the ACL becomes fairly thin as it heads towards its femoral attachment. This can be confirmed on the sagittal sequence as well, where you see a thicker ACL closer to the tibial insertion than you do in the upper segment of the ACL towards its femoral insertion. These are two follow-up MRIs at 12 months post-bracing, with the two images on the left demonstrating a healing outcome whereby the ACL is held in a normal taut configuration paralleling Blumenstadt's line. The sagittal sequences are the best to assess this feature, and on this we can see that the ACL is not only contiguous but it's also of uniform signal intensity, uniform thickness, and is held in a taut configuration paralleling Blumenstadt's line. Whilst the image on the right, or the two images on the right, demonstrate an ACL that, whilst it's contiguous, has a sag or a glide within the ACL and is somewhat of a distance away from Blumenstadt's line, consistent with a elongated ACL or a detensioned ACL. These are two MRIs, double oblique sequences following bracing, demonstrating an ACL that is healed, but the one on the left is of higher signal intensity as compared to the one on the right. And the signal intensity is largely being compared with the signal intensity of the PCL. So if you look at the image on the left, there is this grey, fairly homogeneous healed ACL, which is of higher signal intensity than the native PCL, whilst the image on the right has a low signal intensity ACL, which is contiguous from femoral to tibial footprint and is of similar signal intensity to the PCL. So the image on the left would be classified as an ACL OAS score of 1, whilst the image on the right would be a score of 0.